Hello and welcome to the latest episode of Home Care Hot Seat. Today I'm joined by Finin O'Connor, the Implementation Manager at OneTouch Health, an all-in-one care management platform. He explains how his company serves and supports home care providers and what sets it apart from other suppliers in the sector. So thank you so much, Fin, for joining me today. Really appreciate it. So can I just start by asking you about what is OneTouch Health and what does it do?
Yeah, no problem at all. So, OneTouch Health is a software provider dedicated to the care industry. So, we have developed a connected health platform over the last 7 or 8 years that has been specifically designed to meet the needs of different care providers across the UK and Ireland. So, this has been initially designed in conjunction with our Irish partners where we started off. And we were looking at addressing the needs of domiciliary care providers initially. However, over time, as we developed the system further based on the needs of our partners and we launched into the UK market, we saw that there was a very large need for specialist software to support delivery of complex care and multiple care services under a single platform. So from that point forward, we have been developing the system, again, completely in conjunction with our partners, to be an end-to-end system for all aspects of managing a care organization. So everything from a small domiciliary care agency right up to a national multi-service care provider or a government council provider who run all their own care services. We're able to partner with organizations such as this and provide an end-to-end solution, giving all aspects of the management of care delivery, the management of staff, the evidencing of care delivery, providing a cloud-based platform that allows the staff members to log in from home or from work or from any web-enabled device and to view, update and access the care records and personnel records as needed.
Okay. And you launched in Ireland in 2014, as you say, where you provide for about half the care market, and you now count a lot of UK providers amongst your customers as well. What do you think UK providers are finding from your platform that they've not seen before elsewhere?
I think the first thing is really a single point of contact for all elements of care delivery. So a lot of legacy systems in the UK would have been quite targeted at a singular aspect of care delivery, such as rostering or care planning or other elements. And we came in with a very different model whereby we built a complete platform to do all aspects. And what that means is that you get a system with a huge range of features. And we're really, really proud of the fact that it's got some really great support. So we resource our support team very well, and we make sure that our team are very well trained and have good relationships with all of our partners. So when you are dealing with a single partner when it comes to your technology as a care provider, and you've got really good relationships with your support team there, it makes it very easy to engage and to grow the platform and to ensure that you're able to utilize it fully. One of the best things our partners find is the ability to constantly grow their use of our system. So we're always adding and building new elements in the system, and our partners are constantly adding and building new services and new types of care delivery within their own organizations. So we're able to grow and build with them. The other thing then as well that people really like is it's a fully configurable system. So you can have multiple services running simultaneously on OneTouch. You might have a home care service, a daycare service, an extra care service, and so on and so forth. And each of those can be sitting side by side with the same staff members managing them, but they can be configured quite differently depending on the service needs. And finally, we have a very simple and clear pricing structure. So we charge a single fee per user per month, independent of whether they are the CEO or a junior new care staff member. Everybody attracts the same fee per month, and you get access to the full system. So there's no modular pricing, there's no extra charges for support or anything like that. It's a single per head fee, and it's, like I said, 100% of the system is made available to you, which makes it very, very easy to grow your use of the system over time.
Okay, thank you. The care market in the UK is growing quite rapidly. It's quite large. Can OneTouch cope with this kind of growth, do you think?
Yeah, definitely. I mean, we've grown our team by over 150% in the last 18 months, and we're fully resourced for expansion. And we're very excited by the growth in the market, and we're definitely ready to take on lots of new partners in that way.
Okay, could you tell me about your role at OneTouch and what do you do, what your responsibilities are?
Yes. So I started off at OneTouch as a business development manager. So I joined the company initially I think I was employee number 5 or 6. We were a small little organisation in Ireland, and we were looking at entering the UK market. And since that time, I have been involved in launching us into the UK market, working with all of our UK partners to produce the solution design and configuration that they needed, develop the product itself to bring it to where they needed it to be in terms of all the functionality and compliance requirements. Since that point, I've moved into major account management and more recently into implementation manager. And my main role at the moment is working with new partners to configure the system to be as efficient and as appropriate for the needs of that organization as possible.
Right. And can you tell me how the platform works, what solutions it offers, and who does it help exactly in more detail?
Well, yeah, most definitely. So the platform has been designed to help everybody in the care ecosystem. So not only the care provider, but also the frontline care staff member who's delivering the care. It's also designed to help the service user with our service user portal, and also loved ones and family members with our family app. So we're one of the first providers to have the 4 separate elements in terms of the ability to give access to the ecosystem to both care providers, care delivery, or frontline care staff members, and then service users and family members. So it's designed to help everybody, and it has been really embraced massively by our partners in terms of getting the care teams online and enabling the admins to manage those remotely. The frontline care staff have been able to automate a lot of the really laborious and time-consuming administration tasks that they would have had to do previously through phone calls or filling in forms or visiting the office, and all that now can be automated through the application that we provide to them. So that means that they get more time for delivering better care. So therefore it impacts the service users because they have got staff members that have all the correct information at their fingertips to deliver the most appropriate care possible for that person, and also have more time to do it. And finally, the service users, loved ones, or family members can log in, see what's been happening in terms of care delivery, receive alerts, submit requests, and do all the things that you need to do to ensure that your loved one is receiving the best possible care.
What do you think are the advantages of having all this on one single platform?
So I think the first thing is the single system of record. So you would have, again, traditionally, care organizations would have multiple systems of record. So you would have a lot of different elements, whether that would be a rostering system or a care planning system, or Microsoft Word or Excel, or even a whiteboard or filing cabinets. You would have had information in lots of different places on your service users and staff members. What we do is we provide a single system of record. So that means it's a single login for all staff. It's a single bill to pay for the care provider. And it's really all tied together with a really great support service. So as I said earlier, having a single support team that you have a good relationship with, you know the person you're calling up if you need some help, and you've spoken to them recently, and they know your organization and your build, and they're able to provide that help directly to you. Also, a really important element of that is the instant and reliable transfer of information between all the different aspects of the system. So if a care worker updates something in the care app, the system can guarantee that it will be updated to the office immediately. And that is because it's not lots of different systems talking to each other. It is one single system. So when a care worker or a family member logs in and puts in a request or makes an update to a patient record or a client record, that is instantly alerted if an alert has been configured against it, or is just notified back to the care team or the admin team in head office or the care office. And the reliability of that is really what makes the difference, because it is a single system and it's a single back-end environment that this is happening within. There is no duplication of entry between the care app and the admin suite. It's all the one platform. And the reliability of that makes a huge difference to care teams, because they don't need to double check things. There's no lag in information transfer. It's all reliable and instant.
I think that they're all great things, but I suppose, you know, when you implement this kind of solution, it requires a lot of change and commitment from providers. Do you counter resistance to this kind of upheaval? And if so, how do you manage those fears? Because it's, like I say, it's quite a commitment, especially now when the focus is really on recruitment, retention, that kind of thing.
Yeah, most definitely. So look, I mean, we can provide change at the level that a partner is comfortable with. So we do have some partners join us and they go to implement all aspects of the system from the beginning. That is not the most common occurrence. The most common occurrence is an incremental change. And what we do in that way is we will look at all change requirements, and these are scoped prior to any implementation. A personalized plan is deployed. That's really based on a partner's capacity for driving change and embracing digitization in their organization. Now, there's a lot of different factors that can influence that, be it the number of services they have, the availability of spare resource in their team to manage that, the age cohort of their staff members, whether they're open to new technology adoptions or they need some extra assistance. We're able to provide all of that in a manner that fits your needs. So normally what we will do is we would work with someone to bring on the elements of the system that are going to have the greatest impact on everybody's working day. So if you have a system that has, or an organization, sorry, that has got a lot of issues with staff retention or with turnover or with late filling of shifts because they're of a low resource, we can deploy the solution and tools that will help to fix that at the start. And when the benefits are seen early on in a rollout, people then embrace the system because they can see it's making their lives easier rather than harder. And then they're hungry and they have an appetite for extra features as we roll them out because they know every time they get a new feature, it's a new element of their working day that's being made easier once it's implemented.
Okay, so if I signed up today, how long could I expect to wait until my workforce were all up and running with OneTouch?
We can configure and have a version of the system up for you in a couple of minutes, to be honest. I mean, you could have a platform to sign into in 5 minutes time where you can start bringing in your staff and service user records. Normally we can get a care team up and running for time and attendance, payroll and billing in a 2-week period. So that would be our kind of normal accelerated rollout plan, where we would be able to migrate across all the information from your current system, whether that is a digital online system or whether you have it on an in-house system. We'll get that uploaded for you. We'll train your staff on activating the staff members using the system and getting the schedules published on our platform. And once that is done, you're ready to go. And that's going to have verified logons, create timesheet record, and allow you to run your finance for payroll and billing in a very short period. Beyond that, the pace of change is rather dependent, as I said earlier, on your requirements and your ability to embrace change and your appetite for change. That said, we normally incrementally will add all further functions over a maximum of a 6-month period. Oftentimes it's much shorter than that, but that's kind of the maximum period that we would recommend to get the system fully rolled out. And that's done to reduce business impact and stress on the team. But like I said, if you came to us and said, I would like to fully deploy the system from day one, there were probably a bit more of a lead-in time to get everything planned and ready, but we could have it up and running much quicker than that if you needed to.
Okay, thanks. The end goal for most software providers is to improve the quality of care. What are you most proud of about the OneTouch platform in terms of improving quality of care?
I think our biggest achievement is ensuring the care is delivered in a timely and efficient manner by staff that are happy in their role. And this is due to reduced administration workload and having live access to the service user information they need, and really be enabling staff to deliver the best care possible. So when a staff member is happy in their role, they have the right information they need to deliver care to that service user. It means that they're able to be more dedicated to what they're doing, and they're not chasing their tail with trying to fill in paper-based notes or looking for care plans that are in a folder somewhere in the house, or taking extra time to do all the tasks that we can automate and really put in front of the carer at a finger's notice. A good example is the Pathways Daycare Service in Durham Council. So that was transitioned to a fully paperless system, and we were able to see evidence of improved care delivery across the service very quickly there because of the amount of time that was being spent manually recording all of the aspects of care delivery and double checking records to ensure that appropriate care was being delivered for people with very complex needs. As soon as our system was deployed, we were able to see that staff members had that information at their fingertips. They were using voice to text notes, to speak into the phones, to leave really detailed care records in a very short amount of time, and it freed up a huge amount of time for delivering really quality care. And that's, I think, the biggest benefit of our system.
Okay. What do you think the care industry in general thinks about OneTouch Health?
Those that know of us, I think we're very exciting and engaging organization to work with. They're probably very surprised by the amount of functionality that we can deliver because they will probably have worked with a separate or at least on a market assessment of other providers. And when they actually see the breadth of functions that we deliver in a single platform, I think they can be very surprised. And finally, I think they're just very happy with the customer service they get, and that's really the biggest differentiator we are finding. And it's one of the reasons why a lot of partners tell us they joined us, is because that they were really looking for someone with a good level of customer service.
Yeah. Care software is actually finally beginning to consider care professionals as well in their functionality with things like HR portals and wellbeing services and things like that. What does OneTouch do to address those increasing needs from care staff?
So OneTouch has always been a leader in providing functionality to the care in the platform. So the range of benefits we deliver has always been very, very broad. We've always had a really, really high amount of functionality available in the care app. And that's everything from booking leave to accessing training to submitting expenses, requesting shift changes, setting your availability if that's a requirement of your service or if it's allowed by your managers. We are bringing in new functions all the time, such as hasty payroll advancements, a staff benefits scheme. We brought in a PPE management portal throughout the pandemic, for example, to make it easier for staff to ensure that they always had the correct levels of PPE stock and had a compliance record easily managed within the app. So the Care app has been developed over 8 years of listening to and understanding the needs of care staff across the UK and Ireland. And I think it's led us to have a really unique set of tools at their disposal.
Okay, thank you. And finally, most software companies like yourself claim to save time and money, but can you actually prove it?
Yeah, I mean, we've done quite a few cost benefit analysis of our system when it's been deployed into organizations, and we can often provide a cost benefit analysis that will show that one or two functions of our platform can pay for it in terms of the efficiencies gained. So we can have a positive ROI against such as maybe payroll or billing. So we had a partner that joined us. They had about 300 staff in their service, and we reduced their monthly payroll workload from 32 work hours to 30 minutes. When you look at the cost of supporting those staff through 32 work hours per month reduced to 30 minutes versus the cost of having our system in place, we had a positive ROI just on payroll, and they got the whole rest of the system for free essentially beyond that. So we're very, very proud of the fact that we can deliver our platform at a cost that should be as a positive ROI for selectable functions.
Okay, thank you so much. I appreciate that.
You're very welcome.